Hello, everyone. I am Dr. Don Agpokra of lowcarbneurologist.com. I am a consultant neurologist here in the Philippines, and I am also a low carbohydrate diet advocate ever since I successfully reversed my own metabolic syndrome condition a few years back. In this presentation, I will be giving you a brief overview of the medical and therapeutic applications of the low carbohydrate ketogenic diet among patients in neurology and psychiatry. In particular, I will be giving you a brief overview of the metabolic syndrome, its underlying mechanisms, how it can potentially lead to stroke, and how therapeutic carbohydrate reduction, or TCR, or what is otherwise called the ketogenic metabolic therapy, or KMT, can effectively address and prevent its associated complications, especially stroke, in my professional practice as a neurologist. I am focusing a lot on metabolic syndrome because it is extremely important for us to understand what metabolic syndrome is all about, as well as its immense repercussions to our overall metabolic health, so that we can fully appreciate why the low carbohydrate healthy fats or ketogenic diet is an important and viable option for the greatest majority of the global population. So the metabolic syndrome is a very important phenomenon for us to consider in neurology, especially with respect to stroke as one of its most severe complications. The metabolic syndrome is a set of risk factors which significantly increases the chance of developing diabetes, heart disease or heart attack, and stroke. Other names given to this condition include insulin resistance syndrome, dysmetabolic syndrome, and syndrome X. From the US NHA-NES, or the National Food and Nutrition Examination Survey of the United States, at least 1 out of 5 Americans have metabolic syndrome. Its incidence increases with age, and among those in their 60s and 70s, it actually affects more than 40%. For the Asia Pacific region, a systematic review has noted that nearly a fifth of the adult population were affected by metabolic syndrome, with a secular increase in prevalence. Globally, about 3% of children and 5% of adolescents already have metabolic syndrome, with some variations across countries and different regions. And reading between the lines from the World Health Organization estimates for the leading global causes of deaths for 2019, a lot of non-communicable diseases are actually complications of the metabolic syndrome. This includes ischemic heart disease or heart attack at number one, stroke at number two, Alzheimer's disease and other dementias at number seven, diabetes mellitus at number nine, and kidney diseases at number 10. Considering that 74% of all these deaths in the top 10 are accounted for by non communicable diseases, it wouldn't be far fetched for us to conclude that metabolic syndrome and all its associated complications cause the greatest number of deaths worldwide. Through the exact step by step molecular mechanisms leading to metabolic syndrome is not yet totally known as of the present. Most research in this area point to the development of carbohydrate intolerance and its associated insulin resistance as the putative logical cause. Insulin resistance is that state wherein certain cells of the body, such as your muscle cell, do not efficiently use the hormone insulin for its glucose uptake. Hence, high levels of glucose persist, and this excess glucose that cannot be used as fuel by the cells are brought to the liver and are converted to fatty acids, and thereafter assembled into triglycerides and other lipid molecules in the process called de novo lipogenesis, or DNL. Massive accumulation of lipids in the liver cell or the hepatocyte leads to non-alcoholic fatty liver disease or NAFLD, which has recently already been renamed into what is called metabolic dysfunction associated steatotic liver disease or MASLD. Excess triglycerides goes into the bloodstream, which leads into high triglyceride levels in the blood, or what we call hypertriglyceridemia. Insulin resistance may be due to a combination of genetic and lifestyle factors, and one of the most prominent of which is high dietary carbohydrate intake, especially that high in refined carbohydrates like sugars, high fructose containing sweeteners like high fructose corn syrup, and flour containing products. What are the health problems that are related to or are considered as complications of the metabolic syndrome? Persistent and chronically high levels of insulin, or what is called hyperinsulinemia, leads to the development of selective insulin resistance among certain cells in the body, which leads to the difficulty of glucose entering the cells, even with elevated levels of insulin. Persistently elevated glucose levels, or hyperglycemia, then leads to the following harmful effects. First, you have damage to the lining of the blood vessels and formation of plaques, or what is commonly called atherosclerosis, with subsequent formation of arterial blood clots, both of which are key steps toward the development of heart disease or heart attack and stroke. Elevated insulin leads also to salt retention in the kidneys, causing elevated blood pressure, or what has been colloquially designated as essential hypertension, again leading to increased risk for heart attack and stroke. And continuously decreasing sensitivity of certain important cells of the body to insulin, which can eventually lead to full-blown type 2 diabetes mellitus, again associated with higher risk for heart attack and stroke, as well as chronic complications from diabetes, like diabetic retinopathy of the eyes, diabetic polyneuropathy, damage to the nerves, and diabetic nephropathy, damage to the kidneys, which could lead to chronic kidney disease. You also have non-alcoholic fatty liver disease, or as I mentioned earlier, metabolic dysfunction associated steatotic liver disease, or MASLD, which, if left unchecked, would lead to liver cirrhosis and liver failure, as well as other metabolic repercussions such as insulin resistance of the ovaries, leading to polycystic ovarian disease, malignancy, or cancer due to enhanced growth of cancer cells due to the Warburg effect, and neurodegenerative diseases such as Alzheimer's, which I shall be discussing to you subsequent to this. Now, how is metabolic syndrome diagnosed? We diagnose metabolic syndrome if you have any three or more of the following five criteria, which I am showing here on screen. This is from the US National Heart, Lung, and Blood Institute, or the NHLBI, and the American Heart Association, with some modifications from the International Diabetes Federation. First, you have abdominal obesity, which is defined as a waistline of more than 40 inches in men and more than 35 inches in women, as measured across the belly. But for Asians, for us Asians, based on the IDF metabolic syndrome criteria last 2005, this is translated to less to more than 90 centimeters waist circumference in men and more than 80 centimeters waist circumference for women. And secondly, we have high blood pressure, which is defined as a blood pressure reading more than or equal to 130 over 85 millimeters of mercury, or if you are already taking blood pressure or antihypertensive medications. Third, we have elevated levels of triglycerides, which means triglyceride levels beyond 150, equal to or above 150 milligrams per deciliter, or if you're already taking medications for triglyceridemia. Fourth, you have high blood sugar, which is defined as a fasting blood glucose more than or equal to 100 milligrams per deciliter. Or if you are already taking glucose lowering medications or medications for type 2 diabetes. And last, we have low HDL or high density lipoprotein cholesterol level of less than 40 milligrams per deciliter among men and less than 50 milligrams per deciliter for women. Now, you might ask, is it possible for you to reduce your risk for, or perhaps even reverse, metabolic syndrome, especially if you already have metabolic syndrome based on the criteria I mentioned earlier? The problem I see is the presence of what I'd call irreversible complications due to metabolic syndrome. If you still have not got irreversible complications, such as very severe chronic kidney disease needing hemodialysis or kidney transplantation, or severe stroke with consequent severe debilitating effects lasting the rest of a patient's lifetime, I'd say it would be a resounding yes. Uh, how can we do it? There are a couple of strategies I highly recommend, among which are the following. First, of course, is therapeutic carbohydrate reduction, or TCR, using a low carbohydrate healthy fats diet. If you do this, you need to maintain a diet low in carbohydrates and low enough in carbohydrates, but high in healthy fats. And you may refer to the guidelines, which I call as the low carbohydrate healthy fats traffic guide, which you can look for in my website at www.lowcarbneurologist.com or www.lowcarbhealthmd.com, or in similar other platforms such as that with Dr. Grace Rojo. Since insulin resistance and its corresponding carbohydrate intolerance is the putative main underlying pathophysiological mechanism behind metabolic syndrome, a medically guided therapeutic dietary approach in the form of carbohydrate restriction, or the LCHF, or the ketogenic diet, is the cornerstone of its long-term management. Secondly, we can also do intermittent fasting, or IF, which incorporates an intermittent fasting program in addition to the low carbohydrate diet that significantly help improve your body's sensitivity to insulin and thus further alleviating insulin resistance. You can also do regular physical activity or exercise, because increased physical activity alone can actually improve your insulin sensitivity. This may have an added effect on top of the medically guided LCHF diet. Aerobic exercise, such as a brisk 30-minute walk daily, can promote weight loss, improve blood pressure and triglyceride levels, and reduce the risk of developing diabetes mellitus. Most healthcare providers recommend something like 150 minutes of aerobic exercise each week. Any increase in physical activity is helpful. However, if you just do exercise alone, it will not give you optimal results if your diet is still carbohydrate rich and is very insulinogenic. Next, we have gradually losing weight if you are currently overweight or obese. And that would include healthy eating strategies as well as gradual weight loss until your ideal body weight goal has been reached based on a body mass index calculation of between 18.5 to 25 kilograms per meter squared. But this can indeed help you restore your body's ability to recognize insulin, and thereby improving insulin resistance and greatly reducing the chance of your metabolic syndrome worsening. This is also where the LCHF diet and intermittent fasting works a lot. And lastly, you have medications. Your doctor may also prescribe medications, if necessary, to manage some aspects of your problems associated with the metabolic syndrome. However, these medications may be gradually reduced or perhaps even deprescribe or stop them, especially if your response to therapeutic carbohydrate reduction is optimal. So, what is therapeutic carbohydrate reduction and the ketogenic diet? So, one important question we need to ask first and foremost: the ketogenic diet is one type of low carbohydrate diet based on this tentative criteria collated by the Society of Metabolic Health Practitioners. We have defined a TCR as a dietary pattern that aims to improve metabolic health through the reduction of dietary carbohydrates. It has different levels of dietary carbohydrate reduction, and this includes first, you have reduced carbohydrate, which limits carbohydrates up to 50 to 100 grams on a daily basis. And next, we have the low carbohydrate ketogenic diet, which limits carbohydrates to a maximum of 30 to 50 grams per day. And lastly, we have the very low carbohydrate ketogenic diet, or the VLCKD, which limits carbohydrate only less than to less than 30 grams per day. Based on the three studies that I am showing here, therapeutic carbohydrate reduction used in type 2 diabetic patients has indeed demonstrated marked improvement in several clinical and biochemical parameters, including weight reduction, blood pressure reduction, and decrease in HbA1c, with subsequent effect of deprescribing or stopping the corresponding medications among patients studied here. Now, ketone bodies like acetoacetate, acetone, and DHB or beta hydroxybutyrate can function as alternative sources to glucose, particularly for the energy needs of the heart and the brain. Even during early brain stages in the newborn, they act as building blocks for fats, especially cholesterol, and amino acids. Ketone bodies enter the nerve cells, undergo metabolism in the mitochondria, and generate ATP. In the central nervous system, the brain cells utilize ketone bodies as an efficient energy source in oxidative metabolic process. The permeability of the blood-brain barrier, which is influenced by factors like the presence of monocarboxylate transporters for these ketone bodies, enzymatic processes, diet, fasting, exercise, regulates essentially the metabolism of these ketone bodies in the brain. Aside from the reversal of the metabolic syndrome, which I presented earlier, the ketogenic diet has also been explored as a therapeutic intervention for various neurologic conditions. And while research is ongoing, there are already indications where it has shown promise. This is not an extensive list, but some of the neurological diseases and conditions for which the ketogenic diet has been actually considered include the following. First, we have epilepsy, which is by far the most established and widely recognized use of the ketogenic diet, especially in the treatment of drug-resistant epilepsy in children. It may be considered when medications are ineffective or have intolerable side effects, but by itself, it may be considered a primary therapeutic option, especially knowing the fact that even if many cases of drug-resistant epilepsy, um, it, it works effectively for many patients. Some studies suggest that the ketogenic diet may also have potential benefits for individuals with Alzheimer's disease. Ketone bodies produced during ketosis are thought to provide an alternative energy source for the brain and thus may have neuroprotective effects. And there is also emerging research exploring the use of the ketogenic diet in Parkinson's disease. Some studies have suggested it may help reduce symptoms such as tremors and stiffness possibly through its impact on mitochondrial function and energy metabolism. In multiple sclerosis or MS, while the ketogenic diet has not been as extensively studied in that area in MS as compared to other neurological disorders, there has also been evidence suggesting potential benefits here. And in some individuals with migraine headaches, there is a reported reduction in frequency and severity of migraines while following a ketogenic diet. The mechanisms behind this are not yet fully understood and may involve changes in inflammation and neurotransmitter levels. And lastly, you have the ketogenic diet applications for mental health. And in this area, there is ongoing research as for the ketogenic diet as a complementary therapy for individuals with psychiatric and behavioral disorders such as schizophrenia, autism spectrum disorders or ASD, bipolar disorder, and narcolepsy. So let's go back to metabolic syndrome and the risk for stroke. The cluster of conditions in metabolic syndrome increases the risk of cardiovascular disease. This thing called insulin resistance leads to elevated blood sugar levels, which by itself greatly increases vascular inflammation and damage to the arterial endothelium or the inner lining of the arterial blood vessel wall. Together with elevated levels of triglyceride as well as low levels of HDL cholesterol, this contributes to the formation of atherosclerotic plaques. The same mechanism of insulin resistance in the blood vessel wall can also lead to elevation in your blood pressure. These atherogenic plaques can rupture eventually, leading to thrombosis and formation of blood clots. And the occlusion of the artery in the brain, which is called the cerebral artery, that eventually follows, can then cause cerebral ischemia or what we call ischemic stroke. In cases of uncontrolled high blood pressure or hypertension, the blood vessel walls can also be weakened, and this may lead to the formation of small bulges or what we call microaneurysms, and this is prone to rupture. When this ruptures, it will cause bleeding into brain tissue or what is otherwise called intracerebral hemorrhage or what we have as hemorrhagic stroke. The ketogenic diet has also been used for epilepsy even way back in the 1920s. This diet gained attention as a potential treatment for epilepsy when researchers observed that fasting seemed to reduce seizure activity in certain individuals. The ketogenic diet was developed actually as a way to mimic the metabolic effects of fasting, which leads to the production of ketone bodies. This diet was originally introduced early in the 20th century in 1921 by Dr. Russell Wilder at the Mayo Clinic as a therapeutic approach to epilepsy. And since then, there have been randomized controlled trials to investigate its efficacy. And I'm showing those trials in this table here. Over the years, the ketogenic diet has been used as a non-pharmacological treatment for epilepsy or seizures, especially in cases where medications have been ineffective or had adverse side effects. It has shown success in reducing seizure frequency in some individuals with epilepsy, particularly in children. While the exact mechanisms of how the diet works to control seizures are not yet that fully elucidated, its effectiveness in certain cases has led to its continuous use in the field of epilepsy treatment. And among the proposed mechanisms with regards to how the ketogenic diet works for epileptics includes the following. First, we have enhanced energy metabolism because the ketogenic diet shifts the source of the brain's energy from glucose to ketone bodies and thus stabilizes neuronal activity and reduces seizure susceptibility. Next, we have reduced excitability of the neurons because the ketogenic diet alters the neurotransmitter systems by elevating the levels of the inhibitory neurotransmitter GABA, which is gamma aminobutyric acid, and decreasing the levels of excitatory neurotransmitters like glutamate, thus potentially reducing neuronal excitability. And then we also have modulation of ionic channels. The ketogenic diet may influence these channels, including your ATP-sensitive potassium, sodium, and calcium channels, stabilizing neuronal membrane potential and thus decreasing seizure susceptibility. We have the anti-inflammatory effects also, the ketogenic diet, which actually reduces the production of pro-inflammatory cytokines and contributes to anti-inflammatory effects, and thus potentially lowering the patient's susceptibility to seizures. And lastly, we have epigenetic modifications because the ketogenic diet induces changes in gene expression through histone modifications and methylation of the DNA, influencing neuronal excitability and subsequent susceptibility to seizure attacks. Now, the ketogenic diet has also been used among patients with dementia, especially those with Alzheimer's disease. Alzheimer's disease, or AD, is a form of dementia characterized by a decline in brain cognitive function and marked by progressive neuronal damage. It is the most common cause of dementia worldwide. In Alzheimer's disease, there is impairment in the metabolism of glucose in the neurons in the brain, and this has a corresponding accumulation of what we have called as the amyloid beta the amyloid beta plaques and the neurofibrillary tangles, which is composed of hyperphosphorylated tau protein, which contributes to neurodegeneration and leads to loss of neurons and a decline in cognitive function. Currently, treatments for Alzheimer's disease have focused on symptomatic management and with no disease cure. However, a number of clinical studies have already been done investigating the effects of the ketogenic diet or ketone supplements among patients with Alzheimer's disease, and which I am showing in this table on screen, with evidence suggesting that ketogenic therapy may have potential benefits in Alzheimer's disease by improving cognitive function, memory, and energy metabolism in the brain. Several mechanisms have been proposed to explain the potential benefits of the ketogenic diet among Alzheimer's disease patients, and this includes, first, again, you have improvement in the energy metabolism of the brain, because as I mentioned earlier, instead of glucose, the brain gets to use ketone bodies as an alternative fuel source. Secondly, we have reduction in oxidative stress because the ketogenic diet upregulates antioxidant defenses and thereby reducing the production of reactive oxygen species, or ROS. Hence, the oxidative damage to neurons is reduced. The ketogenic diet can also mitigate the accumulation of your amyloid beta plaques and high levels of hyperphosphorylated tau protein based on studies, thus potentially slowing the progression of Alzheimer's disease. The ketogenic diet may also improve impaired function of your mitochondria, as well as the biogenesis of the mitochondria, which is often observed in Alzheimer's disease. And lastly, the ketogenic diet can modulate the immune system, reducing neuroinflammation, which is implicated in the development and progression of Alzheimer's disease. Next, we have the role of ketogenic diet in Parkinson's disease. So Parkinson's disease, or PD, is a neurodegenerative disorder characterized by loss of the dopamine-producing cells or neurons, or the dopaminergic neurons in the brain's substantia nigra. causing dopamine deficiency, and this leads to motor and non-motor symptoms as well as a decline in cognition of some patients. So evidence has shown promise for the ketogenic diet in mitigating certain features of Parkinson's disease, including motor dysfunction and cognitive decline. And this is outlined in this table that I'm showing here. Among the mechanisms implicated underlying the beneficial effects of the ketogenic diet in Parkinson's disease include, first, you have enhanced mitochondrial function. I noted that earlier in Alzheimer's also, and this has been noted. I mean, the ketogenic diet has been noted to improve impaired mitochondrial function and biogenesis in Parkinson's disease, and this addresses the energy deficits of the brain and reduces the vulnerability to degeneration of the neurons. There is also a corresponding reduction in inflammation because of the modulation of the immune system due to the ketogenic diet. And this neuroinflammation, after being reduced, is implicated in the improvement of certain cases of Parkinson's disease. Third, we have promotion of neurogenesis because the ketogenic diet can enhance the expression of the neurotrophic factors such as brain-derived neurotrophic factor or the BDNF, which enhances neuronal growth, survival, and differentiation. And this potentially alleviates the symptoms of Parkinson's disease. And then you have the antioxidant effects of the ketogenic diet because of its upregulation of the antioxidant defenses. And this causes corresponding decrease in the production again of the reactive oxygen species or ROS, countering oxidative stress and neurodegeneration in Parkinson's disease. Next, we have the ketogenic diet and multiple sclerosis. As many of you may have known, multiple sclerosis or MS is an autoimmune disorder marked by the demyelination of neurons in the central nervous system. And although the ketogenic diet has not undergone as extensive a study in multiple sclerosis as in other neurological disorders like Alzheimer's and epilepsy, there is evidence indicating potential benefits of the ketogenic diet for multiple sclerosis, as I have outlined in this table shown on screen. Among the potential mechanisms attributed to the beneficial effects of the ketogenic diet in MS are the following. Again, we have reduction of inflammation because the ketogenic diet modulates the immune system, reduces the levels of pro-inflammatory cytokines, and potentially alleviates the inflammation-mediated damage of the myelin sheaths in MS. Next, you have improved energy metabolism, again, because of nutritional ketosis, offering alternative energy source for the brain and the neurons, aside from glucose. Third, we have promotion of neuroprotection and remyelination because the ketogenic diet can or may enhance neurotrophic factor expression, thus promoting differentiation of oligodendrocytes and thereby contributing to remyelination and neuroprotection among MS patients. And then lastly, we have the reduction again of oxidative stress because of the upregulation of antioxidant defenses and reduction of the reactive oxygen species production. Now we talk about the role of ketogenic diet among those patients with migraine and migraine headache types. Actually, migraine affects the quality of life of an estimated 10 to 20% of the world's population, depending on the region of the world. And this is with about 25% of these migraineurs experiencing transient neurologic manifestations known as migraine aura. And from previous findings, it has been concluded that migraine is significantly conditioned by a defect of cellular ionic channels. And this is called a channelopathy. And this is known to be dependent on various genetic factors. There have been case studies that have reviewed rather indicating that patients on the ketogenic diet have actually noted significant reductions in the frequency and severity of migraine headache attacks. In migraine, inflammation and elevation of substance P levels induces dilation of the arteries, and this results to the subsequent headache manifestation. So with nutritional ketosis, through its alternative provision of energy, replacing glucose, it mitigates lower blood glucose levels, thus potentially reducing cortical spreading depression in migraines. The ketogenic diet's modulation of amino acid metabolism towards increased synthesis of GABA and its anti-inflammatory and antioxidant effects may further contribute to its efficacy in the management of migraines. And actually, Dr. Angela Stanton, a friend of mine, has been advocating what is called the Stanton Migraine Protocol for quite some time now. And in her support group are numerous success stories of impressive control of migraine symptoms using a therapeutic low carbohydrate dietary approach in conjunction with supplementation of electrolytes. And then lastly, we have ketogenic diet for mental health. The ketogenic diet alters the ratio of your gamma aminobutyric acid or your GABA to glutamate in the brain, and this potentially compensates for neurotransmitter imbalances in cases of schizophrenia, and thus offering relief from symptoms in these patients such as hallucinations and delusions. In other neurologic conditions also, which I mentioned earlier, the ketogenic diet decreases reactive oxygen species and increases ATP and phosphocreatine levels, and it also potentially reduces neuroinflammation. Thus, this is also related to the limitation of apoptosis and neuronal excitability, and thus explaining its success not just in epilepsy, but also among patients with autism or autism spectrum disorder or ASD. Among patients with bipolar disorder and narcolepsy, it is surmised that acidic plasma in bipolar disorder stabilizes mood by reducing intracellular sodium and intracellular and calcium. And since the ketogenic diet induces relative lower levels of glucose or hypoglycemia and activates neurons that contain orexin, it thereby improves daytime sleepiness among patients with narcolepsy. So in summary, the ketogenic diet indeed shows promise in psychiatric conditions through diverse mechanisms with potential applications in the management of such psychiatric patients like schizophrenia, autism spectrum disorder or ASD, bipolar disorder, and narcolepsy. And on top of its known beneficial neurobehavioral effects in patients with epilepsy and Alzheimer's disease. Doctors Georgia Eid and Christopher Palmer are Harvard-trained psychiatrists that are actively involved in the promotion of the role of nutrition in mental health. And their works are focused on the intersection of psychiatric disorders and metabolic health, and you can all refer to their more in-depth presentations should you want to learn more on this area of concern in terms of brain and mental wellness. So in conclusion, therapeutic carbohydrate reduction or TCR and ketogenic metabolic therapies or KMT, which are nutritional regimens that produce nutritional ketosis and increase the levels of ketone bodies in the plasma and the brain, are shown to be substantial in potentially improving brain functionality. And this is often attributed to the improvement of metabolic processes in the nerve cell or the neuron, including metabolism in the mitochondria, signaling of the cells, and the function of neurotransmitters. In addition, these ketogenic regimens can actually result to a reduction in inflammation, as well as reduction in oxidative stress and neurotoxicity, leading to increased stability of the neural networks and thus improving the overall cognitive function of the brain. The evidence from different studies are now steadily growing, and this is this supports the fact that certain neurological conditions can benefit from the ketogenic diet. However, large data still lacking from randomized controlled trials with large populations, and this is often due to the fact that it is quite difficult to implement a dietary study in highly controlled environments, as well as the fact that it is also quite difficult to get ethical board approval for dietary studies that have been shown to cause adverse health effects in comparison with other modes of eating. So that ends my presentation, and thank you for listening to this presentation on the neurologic and psychiatric implications of the low carbohydrate nutrition. I hope you have learned a lot from this, and let's continue to save the brain using the ketogenic diet and therapeutic carbohydrate reduction, or the low carbohydrate nutrition. And again, as I always say, let's fight metabolic syndrome.